Hi everybody, Dr. Susan here. Today I just want to talk to you about my journey as my journey is continuing on. So most of you know my story. Those who don't, I'll make it very quick, but I was diagnosed with MS. It's going to be 10 years now in May. I was debilitated, so I couldn't walk. My right side was completely paralyzed. My right eye was shut. I was in debilitating pain. I was a mess, numbness, tingling, all the symptoms that come with MS, and you could just Google those because it was pretty classic. It presented as a stroke in me. It's different in everybody, but for me it looked like it was a stroke. My diagnosis was confirmed by MRI with contrast, lumbar puncture, and a CAT scan. And so it was multiple times confirmed. The lesions were in my brain. But I knew I had to figure out what was causing those lesions. I knew that my body would heal itself if I removed the interferences. So one of the last interferences I dealt with was heavy metals. So heavy metals were ruled out for me very early on. My first functional medicine practitioner that I went to, straight from the hospital, told me that I was negative for heavy metals. Which, thinking about it, I was like, that can't be true because I had 5 giant metal amalgams in my mouth. It just didn't seem likely that I was negative. So that was a known cause of MS. So it was in my head, but I didn't do anything further. I didn't question him. I just went forth with some dietary changes and some supplements and things like that. I switched functional medicine doctors a couple of times because I kept getting better, I have to say. I kept progressing along the way. But my goal was to be 100% better, and most people were okay with I wasn't, debilitated anymore. But I want to talk about my journey continuing. So I'll just fast forward to 2017. The last lingering symptom that I have was debilitating fatigue. I was so tired, I usually couldn't get past noon. So once I graduated chiropractic school and I practiced the way I practice now, I've been practicing the same exact way for the past 5 years. I had to arrange my appointments so they were earlier on in the day because once the later part of the day came, I was just so tired. I couldn't do it. So I said, when I find the cure to this fatigue, I'm just going to shout it from the rooftops. So it was, I think, January 2017 is when I went on the cellular healing diet. I did much better. It turned into being the ketogenic diet. And ketogenic diet is very misunderstood. So nutritional ketosis is a metabolic process. It's not the diet they talk about on all the internet channels. So I want to be clear and be different. It's different than that. So I'm probably an expert in the ketogenic diet because it resolved my fatigue for the first time in my life, and I've been teaching people low-carb eating ever since. So I do it myself. I practice it with all my patients. So I did that, and that was great and fine. And actually, I was doing really, really well. But in 2019, I just knew I had to get these metals out of my mouth. So 2017, removed all the mercury. My body at that time was strong enough to handle it. Up until that point, because you're probably wondering why I didn't do it sooner, I couldn't handle it. My body was not strong enough to handle it. But after changing my diet and taking the various supplements and doing different things, a multi-therapeutic approach. So after I did those different things, my body was finally strong enough to get the metal taken out, and I did. Got all the metal taken out. And then I knew I started a brain detox on myself, or a detox program on myself, and I couldn't make it through because it's not easy. Real, true detox is not simple. And that's why I do with many patients here in my office. It can be simple for some people. It's not simple for most. So the supplements need to be titrated down. Sometimes supplements need to be added to it. The idea is you have to get through it. That's the goal. It's just how will you get through it is what I would work with people and decide. So I did that. 2017, that's when I worked on the detox. Well, 2017 got the amalgams out. 2018 started doing the detox myself. Wasn't working out well. So the end of 2018 is when I reached out to Dr. Mindy Pels, who's my colleague and very good friend. Love her to pieces, but she dragged me through the fire. There's no other way to put it. So as I was detoxing the metals, I've done videos on this and shared it with people. As the metals were coming out of my body, I started getting repeat symptoms that I haven't seen in years. Symptoms of MS started coming too. and I hadn't seen that in years. I needed her to reassure me that it was going to be okay, and I trusted her. So we went through it. So we did that 2018, 2019. 2019 I call my year of heavy metal detox because that was the year I did it. And it was great. I mean, my energy is great. I feel great. My thinking is great. My thyroid improved. There's so many improvements in my body. My blood work now is actually perfect. It wasn't bad at that time. It was slightly off, but not bad. It was medically normal. But doing the functional blood chemistry analysis, which is a 3D view of the blood, it was a little bit off, so I wanted it perfect. It was now perfect. But the thing is that I know it's not months, it's years. I know, I have the knowledge to know that. I knew it was important, number one. My husband asked me at the time, like, why are you doing this? Because I was experiencing MS symptoms again, and I didn't have it in years. And he was like, oh, why are you doing this? But I knew I had to do it. And why I had to do it is because those metals are constantly challenging my immune system. So in time, I was either going to develop cancer or something, because having your immune system challenged day after day, year after year, never ends up well. So I knew I had to go through that fire, be pulled through the fire by Dr. Mindy. And we did. But also, like I said, I knew. It's not months, it's years. So I want to say that on this video because people think they could do a month of heavy metal detox and they'll be fine. It's not that. It's not that. The thing you have to realize is that these mercury amalgams are off-gassing into my brain for 40 years, 47 years at the time. I mean, that was 47 years of off-gassing. If you haven't seen it, watch the smoking tooth video on YouTube and see what a metal amalgam in your mouth will do. It goes directly into your brain. And it causes all kinds of symptoms that you're not really attributing to that. You're thinking, I'm becoming forgetful because I'm getting older, I'm getting tired, or I'm sleepy. Or I used to think I was tired. I wasn't necessarily tired. My body wasn't tired. My brain was tired, or my mind was tired. So there's lots of anxiety, depression, things happening, or symptoms of my brain not being well. So once I got done with Dr. Mindy this year, I just talked to her again and realize we have to go through another phase of it. Like, I have to keep going. I took off 2020. I did not detox my brain. That was just a choice I made. I just didn't, my body didn't feel like it wanted to do the supplements, and I always tell everybody, honor your body. So I honored my body, and I got off for a year. But just started again last week, detoxing my brain again one more time. And wow, it's just incredible. Because, and what's funny is when I'm on what we call an on cycle, when I'm on the brain detox supplements, my brain feels so good. It's like, it's such a relief. I don't realize then when I'm off, right now I'm on an off cycle, my brain doesn't feel as good as when I'm on cycle. So it needs to be done, and it's being done. So I'm excited to see my heavy metal test, retest. I shared about the retests before. The metals were definitely diminished. It was fantastic. There's just a little more work to be done. And I'm going to take care of that this year. So I just wanted to reach out to all of you to just let you know, it's not months, it's years of work, especially at my age. So I was 40 when I was diagnosed with MS. Heavy metal toxicity was my upper root cause. But because I let it go so far, so I've done videos on knowing now how you tell or know that autoimmunity is happening in your body. And I encourage everybody, if it's happening, reverse it now. Don't wait till you get diagnosed. It's so much harder. So I went all the way to debilitation, diagnosis, brain damage, all of that before I started dialing it back. So here I am 10 years later, and it's been 10 years of dialing it back. So, I mean, right now my life is perfectly normal. I exercise, I have perfect energy. I mean, everything's great. But I know it's still there, and I'm looking to protect my health till the end of days. Like, I'm looking to be not forced into the medical world for any reason. I have not been in the medical world for 10 years. Not that the medical world's bad. I love them. It's not about that. But it's just, I check my own blood. I do my own physicals. And if I needed something, trust me, I would go. There just hasn't been a reason or a need to. So I haven't seen a medical doctor in 10 years since those days in the hospital. And I don't want to go back for any reason. I definitely don't want to be forced, my hand forced, because it's some kind of diagnosis that I can't handle. So I have to protect my health. So I want you to take all this to heart and know your health is your most precious asset that you have. Forget money, forget houses, forget cars, forget clothes, forget toys for kids, forget all of that. Your health is all you have. You have to imagine what it's like to lose your health. I lost my health. I know that is the one thing that I protect, and I'll do anything, whatever I have to do, whatever money I have to spend, I do it because of my health is my most precious asset that I have. I would give up anything to be sure that I'm healthy. That's a fact. And my husband knows that, so he doesn't even question it either. He's like, go ahead, do it. He doesn't even question it because I would do it anyway. No one's going to tell me no. Like, it has to be done. So these are last legs of the journey for me, and I'm excited about it. So we're going through this detox together. I encourage you to please subscribe to this channel because I'm going to tell you things you will not hear. I promise you. You're going to hear things here that you won't hear anyplace else. And this is going to be a channel that can give you lots of hope if you have a diagnosis of how you can get rid of that diagnosis. So I'm always talking about the functional blood chemistry analysis I do. I believe that's my gift, and it's an art form, and I've nurtured it, and I've done over 3,000 analysis now over the past 5 or 6 years, 7 years, since 2013. So I love what I do, and I help so many people to uncover health challenges, to recognize them before they happen and become a diagnosis, helping a lot of young people. So there's another way. There's another paradigm, a functional healthcare paradigm that's specific to you. It really is specific to you because I'm taking your blood. Life is in the blood. The answers are in your blood. It's not a protocol. I never follow a protocol, or I don't have everybody gets the same thing. It's not about money for me. Everybody knows me, knows that. It's all about helping people and spreading the word. And I was given my life back, so I'm here to help people get their life back. So I'm just paying it all forward. So like and subscribe to this channel. Because a lot more information is about to come, especially in the new year. We have a lot of new and exciting things coming, and I want to be able to share them with as many people as I can. All right, I hope you're having a great day today.